You may have seen in the news recently that the Department of Health and Human Services just awarded 25 states new funding to test new and different ways to lower costs and improve the care for Medicaid members. Now, this is certainly welcome news to the Medicaid community, particularly in those 25 states, but in some ways it's kind of old news. I've been hearing from clients over the last 3 years about their different ways of innovating, of trying new methodologies to improve the care of the members of their plan as well as lower costs. And when you think about a lot of the different innovations and ideas that are going on in Medicaid today, they really seem to fall into three broad categories. The first is in the area of member engagement. And we're seeing companies bringing in sales and marketing professionals, adapting a lot of the techniques that commercial plans have used for years and years to further engage the members in their Medicaid health plan. We're also seeing them use a lot of very savvy social media professionals in their organization to further find new, unique, and ways to meet members exactly where they are, to meet them at the point that they need to be engaged. And there's a lot of different ideas going on around that area right now. The second area that we're seeing a lot of innovation is in technology. Now, of course, technology has always been at the forefront of innovations in healthcare, but what's unique about what I'm seeing happening in Medicaid is companies are bringing in non-traditional technology from outside of healthcare that is being adapted and used in healthcare to help lower costs, to help improve care. Verizon is an example that comes to mind, how they're using their technology that they developed years and years ago to find calling card fraud, and now using it to investigate and find Medicaid fraud. And then the third area that we see a lot of innovation around is the whole issue of pushing the care management closer to the member, decentralizing care management or care coordination out of the head office and getting it into the streets, getting it into the community. You have undoubtedly heard about such things as patient navigators and lay people that are being employed in helping find ways to better deliver care and to better meet the needs of people exactly where they are. And this really goes hand in hand with member engagement. So I think you're going to be hearing a lot more about this as time goes on. But it'll be very interesting to hear, for us to know what you're hearing. What are you seeing? How would you say innovations are being applied in Medicaid today? Why don't you take a few minutes and leave a comment with this posting and give us your thoughts. Thanks.